welcome. Can you stop? I'm saying hello. Hello. Hi everyone. Welcome to her channel. I'm her sister. Oh my god. Hello everyone, welcome back to my channel. So today I am with my sister, and as you can see from the title, we are going to be filming a nursing video on how to pass your nursing class and how to pass your NCLEX. So we are both LPNs, and so we're going to teach you how. I became an LPN when I was 18 years old. I'm going to make a separate video about that, and then she went to school for it, but we're going to talk about the tips and tricks to passing your nursing class, okay? Sorry, I look so much like a little boy today. I tried to look.
The entire sun is on my face right now. I am black, I'm sorry.
We tried to. I tried to look more girlier. I have this wash and go in, but I'm sorry, it's not working. I'm ugly. Anyway, so we're gonna just go ahead and start with the tips and tricks for nurses. So we both work in the same hospital. I work in the ER, and she works in the psychiatric ward, forensic psychiatrics. So we've been nursing for a long time, like 1 year now. That's not a long time, but you know.
A year and a half now.
Yeah, so that's how long we've been nurses. So the first thing that you have to figure out when you're trying to go to nursing school is, do you even want to be a nurse? A lot of people have a lot of reasons to be nurses, like, okay, I'm gonna make a lot of money, or
it's really about the money.
It's always about the money, but you do make, you know, a decent amount of money. But if you do not want to be like a nurse, then you're not gonna pass, because nursing school is really demanding and you need a lot of time.
I also want to make a point here. If you thought you were smart, you were one of those students who had A's and B's throughout your whole life.
I say go.
Okay. You had A's and B's throughout your whole life. You thought you were #1 in your class. Let me tell you something. You're gonna get to nursing school and find out you're an idiot.
Yup.
Because if you really thought that your basic math, calculus, I don't know what else you take, well actually chemistry is part of it. But if you thought you were taking socials of woman works and African American history and thought you were gonna be smart, guess what? Roots is not gonna help you. You are in nursing school now. Nursing school is a whole different ball game.
Nursing school, if I can explain it, it's like kindergarten. When you first go to kindergarten and you learn math. What is math? What is social studies? It's literally like starting all over with a whole new subject. Yep. Like, you don't know anything. What you think you know, you don't know. You don't know the body, you don't know nutrition, you don't know psych, you don't know nothing until you actually start reading and learning about what nursing is. And so it's hard to decide whether you want to be a nurse really, because you don't really know what nursing is until you're in nursing school. There's so many things that nurses do that a lot of people don't know. You have to work with homeless people, you have to be an advocate, like sometimes you have to lower yourself. You think your PCT or your CNA is gonna do everything for you? Nope. You gotta learn how to do their things too. If you need to make beds, you are not higher than anybody when you're a nurse. You're all on the same team, and so you gotta learn how to do everybody's job.
You need to learn
even the doctor
right
sometimes.
Now, from the get-go of when you go to nursing school, you better believe, especially during your clinical hours, that you need to be humble. Because if you think you're gonna get trained and helped by any other nurses and you are high and mighty because you got into nursing school, guess what, honey? You could fail nursing school tomorrow. If you really think that getting into nursing school was everything you need to do, you need to pass nursing school, and that's a whole new level. When you're in your clinicals and when you're with your professors, you need to be moldable. You need to make sure that when you're in your clinical hours, that if you don't know something, that you ask. You don't just sit there and act like you don't know what you're doing. You need to say something. And you also need to understand that if they ask you to do bed making, patient care, I don't care if you are an RN with a master's degree, you better know how to do it, and you better do it well, because at the end of the day, your life is on the line, and if somebody says something about you when you graduate and you're a nurse, all that goes down the drain, all your hard work, because your license is gone.
Next tip we're gonna go into is that you need to start early in the year. Now, when people start nursing school, they're excited. Some people like jump right into it, but sometimes you're like little lax, like I was. And you know, you're just like, yeah, you know, I got this, whatever. You think you're smart. No, as soon as you start nursing school, you need to be on top of it, because those topics that you learned at the beginning of the year, they're gonna come right back in the middle, they're gonna come right back in the end. You're gonna need that for the entire year. Nursing school is one big class. It's broken up, but you really need every subject and every topic: nutrition, psych, you need pharm, you need all of that, cardio, in every single thing you learn. So you gotta make sure that you're on top of it from the beginning.
Also, when it comes to reading, when you're preparing for your classes, once you start nursing school, fundamentals, let me tell you something. Fundamentals is your life, okay? When they give you that ginormous fundamentals book, okay, that stuff is all gonna come back to you. Infection control, patient care, APE, ADPI, assessment, diagnosis, planning, what's the other one? I don't know, I forgot.
Evaluation.
And then evaluation.
Intervention, yeah.
Listen to me very carefully. All those stuff, Maslow, is coming back for your
Those
life.
people that you learn about in the beginning, like,
they're coming
back for you.
They're coming back for you because guess what? They're showing up on your NCLEX. And if you thought you were gonna take your whole class and your NCLEX is gonna be a breeze in the park, it's not. The NCLEX is probably the worst part.
What's an important tip to know in your nursing class is that you're like, oh, I'm not gonna need this, I'm not gonna need this. And it's true, you're not gonna need it when you start like actually nursing, but you need it to pass your NCLEX, so you better know it. After you take your NCLEX, do whatever you want, burn your books, throw them in the trash, but you need all that stuff to pass your NCLEX. So I suggest that you take it seriously from the beginning. So the next step is to make friends who are smart, or people who are also willing to pass the class. If you're gonna just, you know, be friends with the people you know, or oh, she's cool, then it's not gonna help you when you need to study, when you need to be serious. You gotta be friends with people who are also serious, because then you're not gonna have any study buddies. And even though me, I pretty much like to study on my own. That's how I like did my own studying. But you know, sometimes you need people, because people can help you to learn something that you may not have understood, or like even you helping someone else, like me, when I helped my friends, like it taught me more, you know, because like it was like almost like a what is it, like a review.
Refresher.
Yeah, it's like a refresher when you're like teaching somebody else, or like when you're teaching the class. So I think it's a good thing that you make friends with people who also are serious about the class.
Oh yeah, like my experience, she did it in high school and I did it in college. So a lot of people, they don't have the opportunity to do it in high school. So from a college perspective, you need to have those study friends who after class they're like, okay, we're gonna eat something and we're going to the library and we're going to have a study room B, and you're gonna meet us there and we're gonna stay there until the school closes. Because guess what? When you're in nursing school, your social life is over, okay? Socialing
really
is not, listen, take your 2 years, tell your husband, tell your children, well actually no, you have children, don't do it.
No,
tell your friends, tell your friends, tell your husband that you're gonna be gone for 2 years, or if you're gonna do your RN/BSN, you're gonna be gone for 4 years. Because let me tell you something, your social life is over. I didn't know that.
So like I'm gonna do a whole video, a separate video of how I became a nurse at 18. I don't know if I'm gonna have that already, but whatever, it's gonna be on my channel, so make sure you subscribe. But a little tip I'm gonna bring in from that, like how I did it in high school, is there are gonna be people you used to hang out with in high school who are gonna be like, why are you not hanging out? Or don't you want to hang out after school, blah blah. And I ended up kind of like not losing my friends, but like I neglected them because I had to focus on the people who were in my nursing school, and those people became like my best friends in school. Like those are the people I hung out with all the time, because we were always on the same page when it came to studying, or even when we did hang out, it was always like after we studied, you know, or like after we did everything we had to do for school. And they were the only people who understood it because they were going through it with you.
Also another thing too, I mean, even though studying is very, very critical, and when I say study, I want you people to understand, you need to read, okay? If you think you're gonna get by the PowerPoints or the bullet points or whatever your professor says, that's nice and all, and it might apply to their particular test, but nursing tests are the same throughout New York State, are the same throughout each individual state you go to. Most of the time they're statewide. I think New York is probably the hardest because New York has everyone, every culture. But if you are studying, you need to read, and I'm telling you right now, as somebody who read it all, the stuff that when it starts going into nursing textbook about clinical experience or clinical assessment, I can't remember, something, clinical judgment, whatever, and when they start breaking it down into the 5 categories that ADPI, you better focus the skill points from those sections. The first part of the book is all anatomy, which you need to know because you need to know the difference between right and wrong. But when it starts getting into that clinical decision making and judgment, pay attention, because not all of that is going to be in your class.
The next part is pay attention in class and don't focus on taking too many notes. So my suggestion is, if you know you're going to have a chapter that you're going to discuss in class, take the notes when you're home. That way when you're at class, you can just focus on what people are saying and what the teacher is saying, because those explanations are not going to come from the book. They're gonna come from your professor or your teacher who's been through it and can teach you how that works, how that system works, or why this drug works this way. When you're trying to take notes in class, you're just not going to be able to listen to what, you know, your classmates are saying or your teachers are saying. So make sure that you can take your notes before you even get to that subject in class. And then also, if it's like a subject, like your teacher's bringing up a whole new subject in class and you haven't studied it before, even still, I wouldn't focus on taking notes. If you really, really want to take notes, take them at home. That's when you're going to take your best notes, when you're studying. Because if you try to just write down everything the teacher's saying, it's not going to really be useful. It's not going to stick in your head because your notes are going to be garbage.
The best thing to do if you are somebody who takes notes is, I don't know how it was in high school. For my college experience, which I think I've heard from a lot of students who do it in college, they have PowerPoints. So you take your PowerPoints and you print them out beforehand on, you can do them in 4s.
We have that too.
Okay, so cool. You can do it in 4s, you can do it in 6, it doesn't matter. Get the ones with the lines and breathe. A lot of professors go, this is important. Or, you know, this is an end class or something. They said some indications and you write those points down. Brief points. And guess what? Just bullets. You don't need to be writing no essays. Okay, you already have a lot to read. For you to go back to be reading and then go back and read essays of notes, it's not gonna help you. You're gonna get tired and you're gonna burn out. You need to be smart about your studying skills.
The next point is teachers are not your friends. I don't know how much to stress this point because when I started nursing school, I was always like, oh, me and my professors are cool. Your teachers are not your friends. They may be there to help you and they're nice because they want you, a lot of them, you know, they want you to pass because like it looks good on them, you know. But like they want you to pass, they want you to get through, they'll try their best to teach you. But when you get a 65, then you're failing, like you're out. If you, well, mine was 75 and below. If I got a 74 like in the class, like they will fail you. Like a lot of teachers, they will try to like do their best to help you and throughout and everything. But once you fail, that's it. No professor, no dean, no people on top, whoever, director, none of them can save you when you fail your class. So if you think that you're gonna be friends with your teacher and they're gonna support you, like, well, they'll support you. But if you think that they're gonna be like, oh, we'll give her another shot, like, no. Just don't be friends with your teachers. Like, be cool with them and have a rapport, but they can't save you when you fail.
At the end of the day, okay, I went to community college. I went to city college. There's about 2,000 students applying. And if you're part of the 70 who get picked, and mind you, even if 70 are picked, about 20 of us graduated. This is survival of the fittest. Your professors, yes, a lot of them are nurses. They went through it, they understand, but this is a survival game at this point. You need to be able to do stuff for yourself. There's no extra, okay, there might be some extra credit. It depends on where you go, but let me tell you something. You not reading and you not preparing and trying to base your life on extra credit, you're not gonna, even if you pass, you're gonna get to the real world and you're going to fail. You're gonna do a mistake and you're gonna lose your license because you don't know what you're doing.
A lot of the learning is not even your teachers, it's you. So if you're depending on your teacher to support you, you're not gonna get through because you have to do a lot of the studying and learning by yourself anyway. So just do not rely on your teachers and don't think that they're your friends because at the end of the day, they will fail you. Next thing you're gonna do is study the topics you don't know and the ones that are popular. And so a lot of the time we get comfortable in nursing school like, oh, I'm really good at this, so I'm just gonna continue doing this or that. No, if you know cardio, don't go home and study cardio. You need to go home and study blood. You need to go home and study, you need to study farm, you need to study nutrition. Well, nutrition is easy if you're feeling nutrition. But I mean, like, you need to study the ones that are really, really, you don't understand. And for people, everybody, it's different. So nobody can tell you like, oh, well, this is harder than this because some people struggle with some stuff and some people think it's easy. So you really gotta just like study the topic that you don't know. And what I wrote here was like, do not focus on Hirschsprunger's disease. Like, Hirschspringer, like, I don't even remember what that is, Hirschspringer's disease, but I know it was in my textbook. So you might want to know like basics, like you should know what it is and like the main point about it. Like if it does something to you, like, or a key symptom, then remember that because those are the stuff that comes on tests. Okay. But don't focus so much on things that are not like important, like things that you barely see, weird diseases that barely come up.
Listen to me very carefully. When it comes to studying diseases, there's about like 2 trillion out there.
There's billions.
If you are in statistics and you're reading about heart disease, about airway, you're reading about cardio, the number one thing is heart attack in the actual world. Your NCLEX is based off of what's actually going on in the world, not from 1955 when Nightingale started nursing. It doesn't matter what Nightingale's. Maybe there'll be one question on Nightingale, and guess what? That one question, if you don't pass, is really not going to kill you. But if you don't know the popular diseases, TB, heart attack,
Stroke,
the flu, stroke, wound care, all of those important actually now things, you need to know what you're doing, because chances are if they're popular in today's real world, they're showing up on your NCLEX. Because if you don't know what you're doing in today's world, how are you going to get anywhere in a hospital or in a nursing home or anywhere you go?
So I work in the ER, and the main things that come in are MI, stroke, trauma. So honestly, what you really need to know for any disease, which is my tip to you, is that ABC, you know, airway, breathing, circulation, respiratory, heart, those are things you need to know are like those with the disease. If you see a question and it's saying something, which one is the most important? If it's not airway, if it's not breathing, if it's not circulation, that's what it's gonna be. That's not if it's not. That's what it's gonna be. So even if you don't know a disease, use your your thinking, and you know like airway is important first, then breathing, then circulation. ABC is number 1 with everything. So don't focus too much on, oh, what is this? I have to know every single thing. No, know the basic stuff for each disease, and then move on. So next thing, you want to recognize it's normal not to understand and to fail a few tests. Not a few, a lot. You will fail. You're gonna fail a lot of tests, and you need to make sure that you recognize that nursing, this is normal for everybody. Everybody fails a couple tests. You don't want to like think, okay, I'm gonna fail everything and still pass. You're not gonna pass, but you need to realize that it's normal to be confused. It's normal to not understand a lot of things, and everybody's gonna go through it, but you just gotta keep working harder and harder to get as much knowledge as possible.
And one thing that my professor told me when I just started is you need to see your way out of nursing school. I grew up getting A's and B's in high school and middle school and whatever class I was doing. I got stars, I got 1, 2, 3s, okay, I got 4s, or all kind of nonsense that they have. When you get to nursing school, if you get a 75, you better jump for joy, because sis, you passed, okay? That's the whole get-go. Passing, if you can get yourself an 80% out, you have mastered the majority of the stuff you need to know, and the other 20% will come with your experience or with your clinicals. But you need to make sure that you're not coming here to get 90s, sis. You're not coming here to get hundreds. This is not your prereqs. This is nursing school. If you're getting hundreds, they're gonna suspect you're cheating. Okay?
Yeah, facts.
They really will. So you need to really seriously, you need to just chill. Like if you're getting 75, sis, you're doing great.
Honestly,
because there's people out there getting 40s, okay, and 50s, and they're getting 30s. I've seen it with my own eyes. You need to make sure that you know that if you're seeing your way out of nursing school, you're gonna be perfectly fine. You're still gonna get yourself a nice job because you're gonna still have passed your classes.
So that is all our tips for passing nursing school. I was gonna go into how to pass your NCLEX as well, but I think I'm gonna put that into another video because I have a whole nother set of points for that, and so I don't want to make this video too long. So definitely look forward to that video. I want to do like a lot of nursing videos on this because me and my sister are both nurses. So you're gonna see, like, if you see like a lot of nursing, then make sure you watch like all of them if you're in nursing school, or if you want to be a nurse, it's important to know this stuff. I'm gonna make a playlist with all those things in there, so make sure to check it out. And that's it for this video. Thank you so much for watching. I hope that you guys do well in nursing school, and if you're going to be in nursing school, make sure you watch all my videos because I can help you out, you know what I'm saying? Even if you're going to RN, if you're going to LPN, honestly, nursing is nursing, so
honestly they're like the same. So
yeah,
I don't know
there's a lot of other things you're gonna learn in RN school, but in terms of tips on how to pass, it's all the same. So I hope that you guys enjoyed this video. Definitely be sure to subscribe to my channel and to like this video for more nursing stuff, and let me know in the comments what you thought of this video, or if there's any other tips that you have thought of that helped you to pass so that everybody else can read it. So I guess I'll see you guys in the next video. Thanks for watching. Bye.